Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. At Town & Country Compounding Pharmacy in Ringwood, New Jersey, owner, pharmacist John Herr and his team are passionate about low-dose naltrexone. They have compounded LDN for over 15 years and are committed to compounding high-quality medications and serving as an educational resource for patients and practitioners alike. Visit tccompound.com. Today my guest is pharmacist Kimberly Hansen. She's from the Town & Country Compounding Pharmacy in New Jersey. Thank you for joining us today, Kim.
Oh, it's my pleasure. Thank you for having me.
So, when did you first decide you wanted to become a pharmacist? Was it something you'd always wanted to do?
Absolutely. I was working in a small independent pharmacy, a traditional retail pharmacy when I was in high school. And on occasion, the pharmacist there would say, "Hey, Kim, go mix these two creams," or "Hey, Kim, go mix these two liquids." I was hooked. I knew that's exactly what I wanted to do. And from that point on, I registered for pharmacy schools, and that was my path. I knew immediately that's what I wanted to do.
Mm-hmm. So where did you study?
Rutgers College of Pharmacy in New Jersey.
Mm-hmm. So you haven't moved far.
I've traveled far, but I haven't moved far.
So once you started compounding, what were the main medications you were doing at that time?
Oh, gosh. Back in the day, it was usually combining a couple of creams together. It was before we had a lot of the manufactured products that we have now. A lot of times compounds start off that way, and then they end up being manufactured items later. So I used to have to make a topical minoxidil solution. I used to have to make up progesterone capsules way back in the day, suppositories for progesterone. This was, 20 some odd years ago. So it was before I knew of LDN. So I was doing compounding before that. Again, mostly progesterone and topical dermatological items that were not commercially available.
Mm-hmm. So how did you hear about LDN? Hello?
I think it was at a compounding seminar. It was the first time I had ever actually heard of it. I think it was being discussed for autoimmune issues. I think it was at a PCCA conference that I had heard of it initially. I started seeing prescriptions from it, I'm going to say about 8 years ago, 7 or 8 years ago. And it was just capsules, and usually it was the 3 different dose levels. But certainly we know differently than that now. But it started gaining traction more for me within the last 3 years. But I did see it back 7 or 8 years ago.
Mm-hmm. And what forms do you compound LDN into?
Right now we do capsules, we do oral suspensions, we also do troches. Most often it's the capsules that we find that patients are happy with, but we can do, actually, let me go back. We also do a cream for patients with autism, and occasionally it's added to pain gels as well.
Mm-hmm. And in your capsules, what filler is the filler of choice for people?
Generally speaking, patients are happy with acidophilus. I do have patients that don't want that, and then we usually use microcrystalline cellulose. But if they have a specific filler question or need, we're happy to accommodate that.
Mm-hmm. And what strengths do you do now in the capsules?
I think our lowest, I actually do a 100 microgram capsule because that patient prefers that to be in a capsule form versus the liquid form, anywhere up to 10 milligrams and anything in between.
Mm-hmm. And what would you say are the most, I would say popular, but that's not the right word, the patient population, what would you say the conditions, the top conditions that LDN is treated for from your pharmacy?
Hashimoto's, pain, depression.
Mm-hmm. So talk us through those three, Kim, of the patients, the experience that you've seen from those patients.
I'll start with Hashimoto's since I said that one first. We do notice as patients are getting to a dose that is appropriate for them, that they are feeling better, and they also require less thyroid hormone. So if someone is on a thyroid hormone and they start LDN, that should probably be monitored more closely than before you started the LDN, because you'll find that as the inflammation reduces, that the thyroid level changes, and therefore you may need to change your dose. Usually it's a reduction in the thyroid dose. When it comes to the pain medication, using it for that, I have patients who have had their lives changed. They were in a tremendous amount of pain before, and they were put on other pain medications, usually one on top of the next, that was just adding to their pill burden, but not really giving them relief and or quality of life that they were looking for. So I have patients who weren't able to do any of their activities of daily life and now are doing things that they haven't done in 20 years. So to me, that makes things tremendously rewarding to know that we can be a part of that and that success story. I should have also mentioned when discussing with pain, I also have patients who have become tolerant to opioids. So we also find that LDN is a way to help reduce the opioid burden and help people get off of those and still maintain their pain relief. So I view those two things together as pain, and sometimes patients are looking to get off the opioids for relief of their pain. So it actually does both. The other that I had touched on was depression. I have patients who are using an increasing schedule of LDN and also then weaning off of usually their SSRI or antidepressant drug. They're finding if they wean very slowly off the antidepressant and titrate upwards very slowly of the LDN, that they're able to get off of the antidepressant and still maintain a non-depressed state. So they're happy to be off the medication and to be able to use LDN, which we know works in a different way and usually has them feeling better overall than the actual quote medication worked for them.
Mm-hmm. And for people that still aren't aware of ultra low dose naltrexone to help combat the opioid crisis, could you talk us through how, when people come to you in your pharmacy where they've been addicted to prescription drugs for many years, how LDN plays a part in getting them off the opioids but still controlling the pain?
I won't get into a specific schedule because it is so dependent on each patient. I will say that we usually start patients on the microdose or the low dose, ultra low dose naltrexone, usually in a suspension form, and they'll be on whatever their dose is, usually for about a month. And then after they're stabilized with that, then the pain management expert will slowly increase the dose of their ultra low dose naltrexone and then also decrease their opioid dose, usually by about 10%. But again, I don't want to give schedules and hard limits because every patient is so different and their ability to reduce, and it's very varied as far as that goes. But I have many patients who have been on rather strong doses of opioids and have been on that for years, have been able to slowly titrate up on the naltrexone and slowly wean down on the opioid and have had success and be pain-free and opioid-free. And that's huge. That's huge to have that happen for them. Specifically, we had one hospice nurse. Now, certainly hospice nurses are very well versed in pain and pain origins and pain protocols. So she herself had her own pain issue. So having walked her through this process of slowly starting the ultra low dose naltrexone and scaling that up over time and reducing the dose of the opioid over time, she is opioid free and is pain free, and it definitely helped her and increase her quality of life, and also to be able to do the things that she couldn't do before. So that's a huge story. I mean, someone who's on opioids to be opioid free is huge.
Mm-hmm. Oh, most definitely. So for people listening out there who are in a lot of pain, because I'm told nearly daily that there is somebody who's in terrible pain, but they're already on very high doses of an opioid. That doesn't seem to be working, and of course, the problem with opioids is your body gets used to them and you have to keep increasing it to, get the effects you were having. So anybody who has chronic pain for whatever reason, or fibromyalgia, or having an autoimmune disease that has a pain component to it, how would they go about finding a doctor who would prescribe LDN, and one that would understand about the ultra low dose, who would be able to help them transition from the opioids to the ultra low dose?
Well, there are two awesome ways to find that out. One is the LDN Research Trust. There are lists of physicians and practitioners on there that are knowledgeable in what we're talking about here, as well as you can also ask your local compounding pharmacist, because we are a treasure trove to know who is actually prescribing it in order to be able to send patients. It works both ways. The prescriber sends the patient, or I'm sorry, sends the order to us, so as they know that we'll do a quality compounded product, as well as I can then refer patients back to other practitioners because I know that they're knowledgeable in this and then they've attended our seminars, and that we can work together with them in order to get the best outcome for the patients. So it works both ways.
Mm-hmm. And I was quite surprised when Dr. Samyadev Datta was telling me how quickly the process is, because I thought it would be a long, slow process. But, he was talking just, a few weeks, which was just like, wow. People that had been on opioids for many, many years find relief. And it just amazes me that something so small and so simple seems, like tickling the pain with a feather in those ultra low doses, rather than using, a really big mallet, which is the opioids, and for it to work, it just is mind blowing, isn't it? And of course, the price, the LDN is not expensive, and many people have to pay for it themselves, and it's not. It's not as a price where it's out of the reach of most people. I know we still have people who do not have money, they're sick, they're not able to work. And if it's a choice between food or LDN, that's a problem. But I mean, we're looking at like $30 a month, depending on where you have it compounded. It's an affordable drug, isn't it?
Absolutely. We try to maintain that, because we do understand that patients are in pain and you don't want them to have to choose between therapy and their regular, their food or their bills or whatever that is. We want patients to get the relief that they need. We've kept what we're doing affordable so that we can make sure that it's available to as many patients as possible. Usually you'll find whatever pharmacy you use. If you do a kit in the beginning, if you're going to be starting a titration and working your way upwards, usually that pharmacy will put together a kit, so you've got maybe 2 different doses of capsule in there so that you can gradually increase to the dose that you are working towards. And then once you arrive at the dose that's working for you, then that pharmacy can make that dose into one pill so that it becomes more economical. Mm-hmm. I hope that makes sense.
Yeah. I had a lady email me this morning. I think she had Sjogren's syndrome, and she was doing really well. She'd worked up to 3 milligrams. It did really well. She's now on 4.5. She's not sleeping. She's not feeling as well. And I was trying to explain that with LDM, it's not the higher the dose, the better the benefit. It's what dose suits you best. And if 3 milligrams, she felt really good, why would she need to go to 4.5? It's not working. It's making her feel ill. To go back to where she was in a good place. But there is so much misinformation out there that people seem to think that this magic 4.5 is the goal that everybody should be on. I mean, have you noticed that with your patients?
Absolutely. I've had patients tell me the same story that you're describing here. Everybody has in their mind that more is better, and that the goal is to get to a certain number, because that's where that's where the best results are. And I'm always cautious to make sure I explain to patients, hey, we're dispensing a kit to you. This initial kit is usually good for 49 days or 7 weeks. But if at some point, halfway through this kit, let one of us know that you're experiencing relief or you're not experiencing anything at all, so that if you are at a dose where it seems to be optimized, I don't want you to have to continue to go up, because the goal isn't to make it more. The goal is to get relief. And if you're getting relief at a lower dose, then stay there, because it's very easy to overshoot that and you'll lose the benefit. Mm-hmm. So in this case, absolutely, more is not better.
Yeah. Do you have any stories of people who are on a very low dose that have stuck to that? That's the right dose for them?
Yes. I had a patient with diabetic neuropathy who was using the kit, and they had gotten to a higher dose and they weren't feeling so good on that. Actually, I'll back that off. He had gotten to, I think it was 3 milligrams, and he went up to the next step, and he's like, you know what, I don't feel as good as I did on the dose before that. Then great, then we know where you should be, and we had him go back to the dose that he had come from, and he's much happier there. He's able to function, whereas he was in pain and uncomfortable before.
Mm-hmm. What I was getting at there was, I mean, I know quite a few people that are on 1.5 or 2, which I mean is low for low dose even, isn't it? Because people tend to think it's got to be, anything under 3 is no good. But even that is too high for some people. Not everybody gets there, as you were saying with the man with his diabetic neuropathy. You don't have to panic or thinking that, you're not taking a right dose. I know some people think that it's not a therapeutic dose if it's under 3, but that is a myth, isn't it?
I would agree with that. It's also, I think I said before, every patient is different in how they respond to it. So even if you have identical twins, I think there is a member of your trust that lectured about this, that there was one set of or no, I'm sorry, it wasn't twins, it was neighbors. They had as completely matched as people go, and same age, same condition, same everything else if you go down the line. And person A got results more quickly than person B, so person B was discouraged, thinking that they weren't going to find the same relief that person A got. And they found that having to start over with patient B and go a little bit more slowly in her titration was the key for her. So whereas a lot of times you'll see dosage regimens that, okay, every week we're going to increase by whatever the increment is, sometimes patients will need to go even more slowly than that and maybe increase them every 2 weeks or maybe every month, whatever that takes. And again, not everyone is the same. So if you get to a dose where you're like, I didn't feel anything the whole way, sometimes you can, wash it out, start over, and go more slowly and find results there. I mean, it's just so dependent on each patient. And just because you haven't gotten the answer that you want and you've gone up to 4.5, sometimes the answer isn't going up a higher dose. Maybe it's starting over and going up at a slower pace.
Mm-hmm. And some people feel quite discouraged starting again. But by doing it very, very low and moving up very, very slowly, the fallout rate isn't as high and the success rate goes up. Because there used to be like this 20% of people that didn't have the relief they were looking for. But that 20% has reduced, hasn't it? We're getting a better success rate now, understanding that there are people who do need to look at LDN differently.
Completely agree. I mean, again, back in the 80s when we were doing 1.5 and 3 and 4.5, and that was such a rigid structure that you probably lost a lot of patients who didn't have success and or probably had side effects that they weren't pleased with. So, changing our thinking now with the results that we have now, knowing that going more slowly and doing slower increases or lower increases is actually beneficial overall. So yes, absolutely. Patients who have tried with not finding their success before doesn't mean you won't have success trying it in a different fashion.
Exactly. And then there's the other school of thought where you have to take it at night. It's not going to work for you if you take it in the morning. But we now know that's not true. Is that what your experience has been?
I would say that's true. I think, yes, in the beginning, the push was, oh, you have to do it at night because your body does its repair at night and do it at night. But, if there's no reason why you can't do that during the day. And there are also reasons why you would want to do something twice a day and do split dosing. So some disease states and some patients do better when they're split dosed. I find that is the case with antidepressant use. Using it for antidepressant purposes, that sometimes a split dose is better for that patient versus the whole dose at one time of day, regardless of morning or evening. So again, very individualized treatment, and you have to listen to the patient and listen to what they're saying to you so that you can work on a treatment plan together. And
you were saying about the topical cream for children with autism. Do you have many children with autism?
We're in New Jersey. We have one of the highest, unfortunately, we have one of the highest percentages of autism in children. So yes, I do see it. Not as often as I once did, but I do see it. And usually they're not amenable to swallowing pills. So usually the parent is putting on a cream, at night when they go to sleep, and they don't even know it's being applied. Even if they take a capsule and they put it into a smoothie or whatnot, kids are wise to that because they're probably on a whole bunch of stuff and they're eyeing up every meal that comes to them, making sure nothing's been hidden. So they're pretty wise to it. So you'll find that the cream is helpful in those cases, and yes, it does work.
And have you come across children with juvenile arthritis or pediatric Crohn's who are taking LDN?
Not in my experience. I have heard of it, but not in my experience here.
And no children or adults with eczema or asthma allergies?
Not in my experience here. I have heard of it, of course, again, but don't have any experience of that directly here.
Okay. Because, it's amazing, isn't it? Initially, going back, 15 and a half years, when I started the trust, it was mainly people with MS. Then it went to Crohn's, then fibromyalgia, ME, CFS, and it was just exploding. But we didn't know too much at that point what it did for chronic pain that wasn't autoimmune. We knew it helped with cancers. We didn't know about all the mental health issues. And of course, it's used in fertility clinics as well, and for women's health. For painful periods, I've forgotten, there's a name for that. And endometriosis, polycystic ovaries. Dr. Phil Boyle uses it in his clinic to help women get pregnant. They take it during pregnancy, during breastfeeding, have really happy, contented babies, he says, and they have less chance of needing antibiotics for chest infections and things, which is apparently is quite common in babies when they're first born. And he said, as a rule of thumb, that those babies are far more contented when they come back for checkups than babies that haven't been exposed to LDN, which I think is quite interesting, isn't it?
I would agree completely with that. It's interesting, if I may, when I have a patient that's here and I'm talking to them and I'm showing them the list of the list of disease states or conditions that this is helpful for. And of course, their question is always, well, how could one thing be good for all of these? And I love that question because that means that you're thinking and you're skeptical, and that's fine. But then when you explain that a lot of these systems are all tied together and how pain and depression are linked by the same pathways, as is your immune system, as are a lot of different things, inflammation, they're all tied together. When you can explain that and have them understand how the different systems in your body interplay, that's when the light bulb goes off. Because traditionally here in the United States, you go to the foot doctor for your foot problem, you go to the GI doctor for your stomach problem, you go to the neurologist for the neurology problem, and really they're not all communicating. And when you look at the thread of symptoms that a patient is dealing with, and it's like you're missing the overall theme of inflammation or whatever that is. And LDN is helpful for that. So therefore, it's helpful for all of those conditions. It's not because they're condition-based, it's because of the basis of what we're looking at here and how those neural hormones and things are tied together. That's where it's helping you.
Mm-hmm. And
I hope that made sense.
It does. And
okay.
Everybody always says at the conferences how the body, when you have some of these autoimmune diseases, pain, about the inflammation. Now, there are other things you can do to help inflammation as well as taking LDN. What do you suggest to patients to do?
For inflammation in general?
Yeah.
Well, it's very important. I always remind patients that their diet is everything. If you look at the glycemic index, it's scaled anywhere between 0 and 100, and sugar being at the top as being 100. You would like to keep your dietary choices below a 50 because they're less likely to cause an insulin spike or have a glycemic effect on your sugar. So if you keep your food items below a 50 more often than above 50, you're reducing the fire in your system. So the whole point of taking naltrexone is to reduce the fire in your body. As I explained before, everything is connected. You can't expect the pill to do all of the work either. Reducing inflammation from that you're adding to the system is also part of it. I mean, you can't walk around eating the standard American diet of high carb and high sugar and poor nutritional value and not have inflammation. You're going to continue to feed the inflammation fire, and then of course, then you're asking the LDN or the naltrexone to help with your symptoms. Sometimes just reducing a lot of the inflammation that way is helpful, and it certainly helps to augment what the LDN is doing. I also find that using CBD products, high-quality CBD products, the full-spectrum ones, are also helpful at reducing inflammation, and using the LDN in combination with the CBD, you get the beneficial additive effects. And I have patients who have needed to use that combination, and they've gotten their quality of life back.
Mm-hmm. It's funny what you were saying about fruit. My mother was in hospital, and she was a type 2 diabetic, but her kidneys were in a very poor state, and she had to have insulin. And she had quite a bit of insulin 3 times a day, 4 times a day. When she got up, lunch, 4 times a day. And she was in hospital, and she'd asked for a banana. And they bought her a banana, how I like them, where they're rather greeny yellow. You know, they're crispy bananas, they're not soft. And she said, oh, no, I don't like eating bananas like that. I like them when the skin is going brown and it's mottly and inside is all, nice and squidgy. And they said, no, you can't have one like that because it's going to affect your insulin because it's very, very high in sugar when it's that ripe.
That is correct.
And my mother but I don't like them like green. I like them when they're really soft. And the nurse was trying to say very nicely, but it's higher in sugar. And I think my mother was thinking, a banana's a banana,
No,
she was trying.
They're actually right.
She was trying to say you can have a banana, but you mustn't have it when it's overripe because it's too high in sugar. So that was quite amusing.
Well, certainly, when I try to talk to patients about that, of course, nobody ever wants to hear that they have to make changes, and nobody wants to give up their banana or whatever it is that they're eating. Everybody likes what they eat. But when you explain it and say, hey, these are inflammatory, what you're doing is adding to your inflammatory burden. I'm not saying completely avoid the bananas, but if you know that you have had a banana that day because you had to have it, maybe look at the bottom of the list to make sure that maybe we're balancing that out and making a choice that has less of an glycemic load than maybe the banana or something else. That's not to say that you should never have banana again, but maybe making choices to balance out your day versus choosing everything above 50. If you reduce the amount of things that are above 50 and take below 50, you're reducing the amount of inflammation in your system, which is good for all sorts of things, which, again, Alzheimer's, heart disease, cancer risk, all of these things are driven by inflammation, and why would you not want to reduce those risks?
Yeah. And it's altering the way you look at food. Instead of it being a diet, which people don't stick to, it has to be a lifestyle change, doesn't it? So it becomes habit. you have good habits instead of the bad habits.
Agreed. If you call it a diet, people assume that that is a restriction on their lifestyle. If you refer to it as health maintenance,
Mm-hmm.
it takes on a different connotation, or inflammation reduction. If you look at it that way rather than, oh, I'm on a diet. Well, you know what? I'm trying to reduce the inflammation in my body. You'll find that you'll get less headaches if you get rid of sugar and carbs, which of course includes bread. There are healthier breads that you can eat. More of the whole grains. Here's a good one. This one I found when I learned this one. I I was amazed by this too. Everybody's under the misconception that, oh, I'll avoid the white bread because I know that's not good for me, and I'll just eat the wheat bread. It's no better. It really isn't any better. It's like a point or two different on the scale. What you need to do is either do it like a whole grain bread or switch to something that's grain free, not grain free, Ezekiel bread, which has a low glycemic index. But there are smarter choices if you're trying to make that effort. There are smarter choices that you can make, so you don't feel like you're on a quote diet where you're restricted and what's the word I want? Punished.
Mm-hmm.
There are ways to still have what you want. You just have to be careful about doing it and continuing to pile inflammatory product after inflammatory product all at your system. I mean, it leads to all of the other health problems that I had mentioned before. I mean, we're all leading stressful lives, and probably you're not exercising as you should, and you're not resting as you should, and you're just adding more and more burden to your system to be able to detoxify, and helping your body do its best
Mm-hmm.
is certainly a better management tool all around.
Well, we've run out of time, Kim. Can you believe that's 30 minutes gone?
I can't believe you wanted to listen to me for 30 minutes. Wow, I'm so happy.
Well, thank you
This
so
is
much.
awesome.
Thank you so much for having joined us. I really appreciate it.
I'm so grateful to have been asked, and it's my pleasure. And if you have any questions, certainly please give me a call, and I'm happy to share anything I know.
Thank you. At Town & Country Compounding Pharmacy in Ringwood, New Jersey, owner, pharmacist John Herr and his team are passionate about low-dose naltrexone. They have compounded LDN for over 15 years and are committed to compounding high-quality medications and serving as an educational resource for patients and practitioners alike. Visit tccompound.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.